So we started our first incision, Dr. Chang. We noticed that our heart rate is fine, so we turned down the ISO. How come we did that?
I think the dog's deep enough and is not feeling any discomfort. My lovely nurse is just checking on the depth throughout the whole process too.
Yep.
And we always want to make sure we use the minimum we need to make sure the patient is comfortable. So
Right.
we're not inadvertently giving too much drugs or
Right.
having the side effects of the drugs.
And then what about low flow?
It's safer for the patient, helps with making sure the temperature is good, and it decreases like the waste gas, so it's safer for the doctors and the nurses involved at the same time.
Totally. So we're delivering less anesthetic that way because our oxygen is much lower. We like to do the low flow because it delivers less of the ISO and you have more control of your anesthesia that way too. Most practices will have, sometimes their oxygen for a dog this size would be 2 to 3 liters per minute. And their ISO sometimes also is 2 to 3 liters per minute, but we try and do the least amount of drugs to affect A, the most pain, and B, also make sure that we are doing multimodal pain management, which is better for the patient. And after we take off this flap, when we're starting to close, we're going to be able to do a really nice local block. So she'll have her systemic medication, and she's also going to have her local pain management for 4 to 6 hours. And if this were a more painful procedure, we can also think about adding other stuff in with our CRI, like lidocaine, doing fentanyl patches, lidocaine patches, and all that stuff. But this one shouldn't be as bad, and we want to tailor the pain management to what the patient is going to experience and not do a one-size-fits-all kind of protocol.